Hi there, Tracy from Kazadans Equestrian. Welcome to this week's video where I'm having a bit of a look at Cushing's disease, what it is, how it's caused, and what you can do about it. Equine Cushing's disease is also known as Pituitary Pars Intermedia Dysfunction, or PPID. Now this sounds like a bit of a mouthful, but it's actually a little bit more accurate to say PPID than Cushing's, and the reason for this is that Cushing's in other species is actually different to Cushing's in horses. So as the name suggests, Cushing's is something that involves the pituitary gland, and the pituitary gland is important in releasing hormones. What actually happens in the case of PPID is that a benign tumour begins to form on the base of the pituitary gland. Now this happens due to a decreased amount of dopamine being produced by the hypothalamus in the horse. So something is causing a reduction in one hormone, which is in turn creating this benign tumour on the pituitary gland. Now when the tumour occurs on the pituitary gland, what it does is actually enlarge this gland. As the gland is enlarged, it secretes a lot more of ACTH, which is a hormone that actually controls the amount of cortisol, which is a stress hormone in the body. So we get an increase in ACTH, therefore we also get this massive increase in cortisol release. So what does cortisol do to the body? It increases blood sugar, it actually decreases your immune system, and it stimulates metabolism of fats, proteins and carbohydrates. So once this dysfunction has occurred, we're getting this excess cortisol, and you can see by the way it actually acts how it can cause such metabolic problems for the horse. So this is a dysfunction that occurs over time. So the tumour can become multiple tumours or bigger tumours. Initially there's not much there at all, but it will increase over time. Normally we don't see the disease occur until a horse is over about 10 years old, and the average age of diagnosis is about 19. It is actually really quite prevalent in our aged horse population. Mares and geldings are affected equally, but ponies seem to be a little bit more predisposed to this. So what are some of the signs that you need to look for, especially in your older horse, that they may be developing Cushing's or PPID? Recurrent and unexplained bouts of laminitis, and also a long sort of curly coat with a lack of shedding tend to be the most noticeable and often recognised signs of PPID. Some of the other signs you might see is excessive drinking and urinating, lethargy, weight loss and increased sweating. Even a delay in the shed. So if you have a horse that sheds a little bit later in the season than other horses, that can sometimes be an early indicator. Some of the other signs that aren't as recognisable or aren't as common, ravenous appetite, pot-bellied appearance, and the fact that there's a decrease in the immune system response also makes them a little bit more predisposed to skin problems, sinus problems, dental disease, respiratory illnesses or diseases, and also they're more susceptible to worm infestations. The abnormal coat changes can vary from horse to horse as well. As I mentioned, it can be just that they shed at a different time. It can be a mildly longer coat, all the way through from there up to the development of about a 10 centimetre curly, wavy coat on the horse. Another more subtle sign is that quite often these horses get an unusual fat deposit just above their eye where there is normally an indentation. If you have a horse that's showing any of these signs, or you've got a horse that is diagnosed with PPID, then laminitis really can come hand in hand with that, and you need to be treating your horse and on the lookout for laminitis constantly. Obviously, diagnosis can be done by nobody other than your veterinarian. So if you recognise some of these symptoms, please get along to your vet. They do some hormone tests to clarify. Sometimes a vet can simply see some of the obvious clinical signs like the coat change and the history of that horse, and may be able to simply diagnose from that. But you certainly need to be involving your veterinarian in your horse's care if you see any of these signs. The testing for PPID can be a little bit difficult as well, which is why it's also important to involve your vet early in your recognition of some of these signs rather than later. Some of the early tests, however, can give you a false negative response. As the disease progresses, the testing does become easier, but we want to try and limit the symptoms that your horse gets and have this diagnosed earlier rather than later. Once your horse has been diagnosed with PPID, then there is no cure, sadly. However, symptoms and treatments are available through your vet, so this is why you need to involve them in the care here. Vet will recommend either medications, but sometimes if you catch this at the right time, you can simply modify the horse's diet, keep an eye out for some of the other symptoms. Not all owners will actually even choose to treat the disease. They may just treat the symptoms. This really depends on how severe the case is and how bad the symptoms are. If the disease isn't well developed, this isn't a bad approach to take, but a lot of consideration to diet needs to be taken here. Modifying the diet and creating a lower sugar diet will actually assist the horse not develop some of those symptoms like laminitis, equine metabolic syndrome, or insulin resistance. So reducing the sugars in the diet for this horse is very, very important. And at this point, involving a qualified equine nutritionist in your healthcare team is really wise as well. There's a case to be low sugar for every single horse, so this is just one more of those times for you to have a look at how much sugar your horse is getting. So why is PPID so common in aged horses? Well, in fact, the pituitary gland, and that part of the pituitary gland, is actually controlled by some nerves that just degenerate over time. So really, this is just a symptom or goes hand in hand with the process of aging. Obviously, these nerves degenerate in some horses faster than others, and these are the horses that we tend to get the clinical symptoms and the disease early. As the horse ages, their increased risk of developing PPID obviously increases quite a lot as well, up to the point where if you've got horses in your 20s or 30s, there's likely to be about a 50% of that population to have some level of equine Cushing's disease or PPID. So thanks for watching this video. I hope it's given you a very brief oversight of the disease we call equine Cushing's disease, or more correctly, PPID, Pituitary Pars Intermedia Dysfunction. Hopefully, I've helped you be able to recognise some of these symptoms and signs early, so as your horse ages, you can keep a really close eye on it. Involving the vet early in the horse's care is actually going to help the prognosis for the disease. Of course, there's no cure, but we do have the treatments we can discuss with our vets. Thanks for listening. Just giving you one more tip to help look after those beautiful old horses that we have a little bit better. Recognising these signs and symptoms in the horses really does increase the quality of life and provide that lovely retirement and quality of life that our senior horses deserve. So don't forget, if you haven't already, please subscribe to my channel. Don't forget to click the notification bell so that you get notified when I release my weekly videos. Share this video around so we all as a horse community can start looking after our oldies a little bit better. Thanks for listening, and I'll speak to you next week.